Hello, this is Katia from your Midwife. This is my second video on coronavirus, and today's topic is pregnancy, postnatal guidelines in the NHS and in the UK at the moment, and coping strategies. So you're pregnant, or you've just given birth, and for the past 3 weeks, all of your plans have gone completely out of the window. This is scary. This is disappointing. And it's okay to feel sad and anxious about what is going on. But most importantly, you need to make sure that you're aware of your feelings and you make sure that you talk about them to someone. That could be your husband, your partner, your midwife, your doctor, anyone. As long as you speak to somebody, we can all support you. Okay? In terms of what's going on in the UK, in the maternity wards, we are following the guidelines from the RCOG and obviously what NHS England has been telling us to do. So the RCOG is basically the Royal College of Obstetric and Gynecologists here in the UK, and the main guidelines are in regards to the antenatal appointment, postnatal appointment, and what to do in case there is a suspect patient with COVID-19. So first of all, what's going on? Since the 16th of March, you've been basically at home, not being able to go out for anything else but food shopping, medicine shopping, or work if you are a key worker and you have decided to continue to work. Why is that? So pregnant women have been put in the high risk group for coronavirus infection, but it's not because you're more likely to get it, but it's because if you get infected with coronavirus, the manifestation of this infection, which is COVID-19, could be more severe if you're pregnant because your immune system changes during the pregnancy. If you are in the second and third trimester especially, it's very, very important that you stay home, go out only if it's essential, and you keep your hands nice and clean, and you use a mask if you feel the need to. At the moment, we're not recommending to use the mask every time we go out, but especially if you're using public transport or if you are out and about, if you're going for a shopping, if you're going to an antenatal appointment, wear a mask, okay? In terms of what we're doing at the hospital, in terms of our and your protection, we are now using PPEs, which are the personal protection equipment, which are basically a mask, some goggles, and an apron. So every time we carry out an antenatal assessment, or if you have been admitted to the hospital, you will notice that everyone who will come into contact with you will wear a mask, an apron, and goggles, and obviously gloves. So why we're doing that? We're doing that first of all to protect you if we have any minor symptoms, and to protect you from us transferring our droplets from talking, from sneezing, from coughing. Okay, and also we protect ourselves because if you sneeze or cough, we have that barrier that comes from the masks and the aprons. And we normally, before leaving the room, as soon as we finished with you, with seeing you and we're doing our assessment, we always dispose of all of these personal protective equipment and put a fresh one each time we see a new patient. So rest assured that we are protecting ourselves and others. In terms of antenatal appointments, that's a good point. So probably you've received a phone call from your midwife saying that your antenatal appointment has been postponed or has been swapped to a telephone appointment. I know it doesn't seem right. I know it doesn't seem fair, but we're doing that because at the moment, every hospital is trying to redeploy staff wherever it's more needed. So in terms of us midwives, we are human beings. So quite a few of my colleagues have been in self-isolation because they've they've become symptomatic for COVID-19, or somebody in their family have started to show symptoms. So that means that we are short-staffed at the moment, and we need to make the most out of it. So it means that if we have colleagues who are able to help us out in the labor ward and in the high risk areas, or the areas that need more attention, obviously these people will be redeployed over there to make sure that whoever is in hospital is in safe hands. In the antenatal period, it doesn't mean that we have abandoned you, we've forgotten about you. As I said, you've probably been swapped to a telephone appointment. During the telephone appointment, the midwife is going to ask you a few questions to make sure that you and baby are doing well. Normally, the guideline would be to alternate phone appointments with face-to-face appointments. And in terms of face-to-face appointments, if you have one coming soon which hasn't been cancelled, you must go and attend your appointment. It is very important that we keep an eye on you and the baby and make sure that everything's going well. If you're worried that you may catch coronavirus while you're in hospital or while you're in the NHS hub to attend your antenatal appointment, speak to your midwife, just voice your concerns, and they can reassure you that it's completely safe for you to attend your appointment. So remember to attend your appointment. If this is a phone appointment and the midwife thinks there is something that's not really right, obviously they're going to refer you to the hospital. In general, if you haven't heard from your midwife for a few weeks and you do an appointment, or you were doing an appointment a couple of weeks ago, no one's got back to you, or you had to postpone the appointment for some reason, make sure that you make contact with your midwife. In theory, they should have contacted you already to reschedule your appointment, or anyway to catch up with you and see how you're doing. But otherwise, if you're worried about anything, just let your midwives know and call your local hospital. If you start developing any symptoms of any obstetric complications such as preeclampsia, so headaches, blurred vision, flashing lights, stomach pain, or puffiness, especially in your hands and feet, you must attend the maternity assessment unit. If you feel that your baby is not moving as usual, or the pattern of movement has changed, call your midwives and go to the maternity assessment unit. All of this stays the same. So if you have any concerns, contact your obstetric triage or maternity assessment unit, whatever it's called. Speak to them about your concerns, and they will let you know what to do, if you need to come to the hospital or not. In terms of postnatal appointments, if you've been discharged from the hospital, you've probably received a phone call from your midwife letting you know what to do in the next few days. Unfortunately, they won't be able to do home appointments, home visits, but they will give you an appointment to attend a community hub between day 5 and 7 after your baby is born, to check the baby's weight and to do the blood spot screening. That means they need to take some bloods pricking the baby's heel. Okay, and then on day 10, so 10 days after the baby's born, the health visitor will give you a call and tell you how the baby clinic has been reorganized at the moment. So again, no one's going to forget about you. If you need extra support, both the NHS and private services have started doing video consultations. So we're using Zoom, we're using Skype, we're using secure softwares to make sure that we can see you and baby and do an assessment. In rare cases, we may accommodate you with a face-to-face appointment, but that's given the fact that the midwife who's going to look after you have the correct PPE to keep themselves and you safe. In terms of what's happening in the hospital once you go into labor, so you've probably been told, or if you don't know, I'm going to tell you right now, and this is another disappointment. You've probably been told that your partner is not allowed to stay with you in early labor. So my advice to you would be, stay at home as long as you can once your contractions start. Even if they're strong, even if they're regular and they're coming every 2 to 3 minutes, so you count 3 or 4 contractions every 10 minutes for at least 3 hours in a row, which don't seem to become any easier. But if you can still cope with the contraction, with the intensity of these contractions, please stay home unless you're concerned about yourself or the baby. So when you go to the hospital to give birth, you will probably be already in established labor. That means more than 4 centimeters of dilation, and they will allow your partner to stay. So partner cannot stay with you if you're not in established labor. So if you're less than 4 centimeters dilated, your partner will be sent back home, or they can go anywhere outside of the hospital to wait for us or for you to give them a ring when the time has come. And then after the baby's born, they're allowed to stay up until baby's 4 hours old. After that, I'm afraid you're not allowed to have any more visits until you go home. On the day of discharge, your partner will wait for you at the reception of the postnatal ward or the birth center, depending on where you giving birth. And then the midwife looking after you on the postnatal ward will escort you outside with your bags. And that's when you can see your partner again. Obviously, if your partner presents symptoms of COVID-19, even mild symptoms, I'm afraid you cannot bring him or her alongside with you. So obviously, you will feel very lonely, you will feel sad, again, you will feel anxious, and you will feel scared. Make sure that you talk about it to the midwives who are going to look after you, because again, we're here to help you. In terms of coping strategies, so I've told you loads of stuff in the past 10 minutes, and most of it wasn't very great news. You probably had a birth plan, you probably wanted to have home birth, and your midwife has just told you, no, we closed the home birth team because we need more midwives in the hospital. So I'm afraid you will have to give birth in our hospital birth center. Or you wanted to have a water birth and your local hospital has just told you, okay, because of the risk of COVID-19 and spreading of the infection, we're currently not doing water births. During labor, there are so many other options that you can adopt, and you can talk about it with your midwife. I'm going to make a video in the next few weeks about alternative positions and active labor. So at the moment, let's just focus to coronavirus. In terms of coping strategies, if you feel anxious, if you feel depressed, or if you already have a history of depression, of anxiety, and you're on medications, or you're followed by a perinatal mental health team, probably you've been given some links to check out, and in order to seek more support from a counselor or a psychologist. If you're new to anxiety, if you feel really sad and you can't help it, then in the comment section of this video, I'm going to add a few links that the NHS are providing, or also other private non-profit organizations which are helping us out to give help and support to those people who do feel helpless and sad and anxious about all of this situation. You are not alone, okay? In the meantime, what can you do at home to ease off the anxiety, to ease off all these bad thoughts? First of all, practice mindfulness. So mindfulness is that practice where you try to focus on the now, okay? By focusing on the now, it means that you don't think about everything else that's surrounding you. You try to space out completely and think about something nice, a happy memory, a happy place, somewhere where you can feel secure, somewhere where you can feel happy or relaxed, okay? You can start by just taking mindful breathings. That means that if you try to sit down and relax, or you can lay down on your bed, close your eyes, try to relax your body, just leave your arms alongside your body. Close your eyes, take a nice deep breath in with your nose and feel your lungs filling up with air. And then when you exhale with your mouth, nice deep breaths, exhale with your mouth and feel that your lungs are emptying and they're getting rid of the air. They're getting rid of all this sadness and you feel like you're getting rid of a weight on your stomach. Do it for 3 times, just 3 consecutive nice deep breaths, as many times as you want during the day. This is a good start. But then obviously, if you feel like you need more support, talk to someone, talk to us, talk to your partner. We're all here to help. Other coping strategies, if you already had a baby or if you haven't had a baby yet and you feel like so useless that you need to stay home and you don't know what to do, then first of all, just finish your baby shopping. I'm pretty sure you still have things to buy. There are great websites where you could buy anything you want for your baby. Make sure you check the reviews because you've got more time, because either if you're smart working or anyway you're at home on mat leave and you don't have much to do during the day, just check those websites. If you've seen that cute little dress for your baby, just have a look at it. Go with a newborn or up to a month size. So if you're not sure about how big the baby's gonna be, pram shopping, just go check those reviews. Have a talk with your friends, with your sisters. I don't know if they've had babies, to check which pram would be more appropriate for you. And then obviously you can start batch cooking. Well, do a bit of bulk cooking to put in the freezer. There are loads of websites with very interesting recipes to make your food from scratch. So to help you go through the first few weeks with the baby, when your focus will be on the baby and baby alone, and even your partner may get involved with the baby as well. So make the most out of it. This is my advice. Make the most out of it. Take advantage of the fact that your partner will not be only on maternity or paternity leave, but they might be with you for a bit longer, and so that there will be the opportunity to be more hands-on with the baby, more hands-on with the houseworks, and they could give you so much more support. So look at the bright side. I know you won't have your mum, your sisters, your best friend with you, but you can still connect with them using social media or using WhatsApp or using whatever you fancy. But you will start building the happy family with your partner with you 24/7 for the next few months. So again, look at the bright side of all of it. I know it's a very scary moment, and hopefully it will be finishing soon. But in the meantime, let's try to get on with it. And let's try to see the positives of everything. And if you need any support, any help, you rest assured that all of us, NHS and private, are here for you to help. So this is it for today in terms of what to do in a nutshell. If you have more comments, more questions, please don't hesitate to ask. As I said, in the comment section of this video, I'm going to put all the useful links for very interesting apps to help you breathing and websites to check if you feel anxious and depressed. If you have any other comments, or if you found this video particularly interesting and useful, share this video with your friends and like my page, Your Midwife UK. I'll see you soon in a few days with another video from the coronavirus series. For now, have a lovely evening. Bye-bye.